I first knew that I wanted to be a doctor at about age 10 to 12. My mother was a nurse, and my father was in the dental profession. And so I was around people who discussed medicine on a regular basis. I think the thing I enjoy most about women's medicine is probably dealing with the women themselves. Women are very in tune to their health. They're very proactive. They're very open to advice. They come for their exams when you ask them to. Unlike us men who don't do very much until they're dying or until something's really wrong. The part that I enjoy the most in my field would have to be, initially, was delivering a baby. Later in my career, as I became more into and proficient in surgical techniques, I would say probably at this point it's the surgery which I enjoy the most. I think the most challenging aspect of my job is to integrate the art of medicine with the science of medicine. There is an art to giving good care, I think, because just the art of sitting and talking to a patient, of listening to their complaints, trying to sort through those things. It's not always just a matter of how much you know, it's what you do with that information. My most memorable patient encounter, and there have been quite a few in my 33 years, would have to have been just recently when I saw a patient that I had seen for many years, and she came in for her annual exam, and on her exam I thought I felt something abnormal. So I got an ultrasound, and it turned out that she had a very early ovarian cancer. She had no symptoms. Ovarian cancer is something that is not detected usually till it's very late. And so we did the appropriate studies. She was sent to the oncologist, and after surgery she was told that she was cured. She sent me a beautiful basket, and she wrote me a very, very nice note. And in the note, among other things, she said, "You are my hero because you saved my life." And whether that's true or not, I don't know, but it was very gratifying to hear that. If I could describe myself in 3 words, it would probably be to say that I'm thorough. My wife would say I'm obsessive, but I prefer thorough. That I am calm in a crisis, and that I'm compassionate. In my spare time, I really love to read. I've always liked to read. I love historical fiction, and when I'm not reading something that I have to read, that's the area that I tend to gravitate to. So I do spend a lot of time reading. I also love to walk and be outside, and my wife and I walk a lot all around Laguna Niguel, up and down, and I really enjoy gardening. I think I keep myself current by doing what we all have to do, which is continuing medical education. I do try to go to as many lectures and functions that I can to learn about new techniques and new drugs. One of our physicians is very interested in the robot, and I've worked a lot with him, and I'm thinking that perhaps I may go to some of the conferences with him. I think Orange Coast Women's Medical Group is different because we have an accumulation of what I think are some of the finest practicing people in Southern California. We also, because of our size, have the wherewithal to avail of ourselves of a vast array of new technology. We have a DEXA scanner, we have an excellent obstetrical ultrasound department, we have an aesthetic center and laser therapy, and we also are the only group that I'm aware of in this entire area whose office is on the same floor as labor and delivery. So we're really able to be right there for our patients if they need us.